DocTalk is brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Triangle vaccines. Triangle, protection you can trust.
Hey there, folks. Welcome to DocTalk. Dr. Dan Thompson here at Kansas State University. I am tickled to death that you tuned in this morning. We have Dr. Justin Smith, who is the Deputy Animal Health Commissioner here in the state of Kansas, and we're going to be talking about trich. Stay tuned and enjoy the show.
It must be an inherited trait because I have never wanted to do anything other than be in the cattle business. And it's interesting as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it has been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
Justin, welcome to the show.
Well, thank you, Dan. Appreciate being here.
Folks, this is Dr. Justin Smith, and he is the Deputy Animal Health Commissioner for the Kansas Department of Agriculture here in Kansas. And Justin, you see a lot of the state.
Mm-hmm.
And, you know, what exactly is kind of your role as a Deputy Animal Health Commissioner?
Well, presently, I'm the support for our Animal Health Commissioner, but it's honestly what our mission is that we protect, we develop the regulations, we protect the animal health industry here in the state of Kansas. And so our goal is to try to come up with practices that allow the producers to do what they need to do, but still understand that there is a safety factor and to make sure that we're not putting Kansas's livestock production in grave nature.
Yeah, sometimes, you know, when we have the term regulations, people think we put them in place to protect the individuals, not hurt them.
Exactly. And honestly, it's a fine line, but yeah, that is why they're there.
Yep. Well, we're glad to get you on the show and glad to, because trich is something that when you pick it up on every magazine, we're seeing it on our extension bulletins and all around, and you're right in the middle of it.
Exactly. No, trich has really been the hot button issue in the state of Kansas in the last 3 years, as well as nationally.
Yep.
It really is.
So let's just start out. What is it that we're dealing with here?
Okay. Trich, in short, is a venereal disease of cattle. Mm-hmm. It is a protozoan. A lot of folks, if you understand what cryptosporidiosis or coccidiosis, it's the same type of organism, but it is a different organism. But it is a venereal disease that is passed strictly upon sexual contact between our bulls and our cows, and it tends to cause usually a mid-term abortion. We can't see a late-term abortion with it, but usually it's an infertility and lack of pregnancy.
Okay, and so when we're dealing with this, you know, I would assume that a bunch of open cows or something to that nature is kind of the...
Definitely, and unfortunately, that's a lot of times the first sign. As guys realize at preg check time is, wow, we didn't get the conception rate we needed to have, and so then they start looking into, and obviously the bull is the first thing they look at, but once they determine that he still is good, that's when the trich thing starts to rear its head, and so, but yeah, and unfortunately that's a little late in that respect.
Is this something that survives? Does it have to survive on the bovine? Can it survive in the environment? Does it, you know, what?
Sure. No, it's an obligate organism. It has to be on the animal. It doesn't survive out in the atmosphere or in the environment very well at all. And so it does take an animal-to-animal contact for it to happen. And when I say that, I should specify animal-to-animal venereal contact. It isn't that they're going to change it nose to nose or they're not going to breathe it in or whatever. It is a sexual transmitted disease. So.
Well, I think it's some fantastic information. It's a hot topic. We're going to take a break.
Okay.
We'll go to commercial. When we come back from commercial, we're going to talk a little bit about the impact that trick can have on the cow herd. You're watching Doc Talk. This is Dr. Justin Smith. We're sure glad that you joined us.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. Meet the Veterinarian, brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Dr. David Sakloshia is the Operations Manager of Animal Health and Welfare and Staff Veterinarian for Cattle Empire, one of the largest family-owned cattle feeding operations in the U.S. Over the years, Dr. Dave has championed the humane care and handling of cattle and is currently chair of the AABP Animal Welfare Committee. In 2013, AVC named him Consultant of the Year.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Hey there, folks. Welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Justin Smith, and we're at Kansas State University, where Dr. Smith is the Deputy Animal Health Commissioner for the state of Kansas, works in the Kansas Department of Agriculture, and we got him to break away from his schedule, come down here and visit with us about trick. And you know, we'd already mentioned a little bit about the abortions, but just, you know, overall, what are some of the examples of what we're seeing out there in the industry as far as cases or things to that nature?
Okay. Here in the state of Kansas, honestly, we do have trick. It is out there. We've been monitoring this disease for about the last 3 to 4 years pretty hard, looking at positive cases. I will say we don't have a huge problem here in the state of Kansas, but it's definitely there, and it's something that guys need to be aware of. We've looked at it, and we get anywhere between 16 to 17 positive cases a year. This year we're sitting right at 11 right now, but we've got a few months yet to go is what it amounts to. It obviously, it can be of various impacts. We've seen herds, unfortunately, folks, it's been up to 80% open rates on some of these cows. Where typically the guys will find a 10 to 12, maybe 15% open rate that first year, and that's what kind of really kicks it off. But if you get a bull population or bull battery that is infected, yeah, it can be devastating and has been devastating to many herds. Okay,
so the some of the things that we need to focus on then is it's a venereal disease. It's passed only through sexual contact between animals, not nose to nose. So obviously diagnostics and
That is the important thing, and that's the key thing to remember, that there is no outward signs of this disease. I defy you to go out and tell me that bull is positive or negative. So you can't visually look at that animal and see that. A lot of times the abortion's early enough that you will never see anything other than maybe some blood-tinged mucus on the tail. So it tends to be a real insidious type organism, or real insidious disease. So the diagnostic is key. The testing is key. We have to test these bulls on basically an annual basis, and a lot of times if you got multiple calving season, yearly basis, or twice a yearly basis.
Really?
Yes.
So let's jump into, is there any type of biosecurity or thoughts of cows and heifers?
Sure, definitely. We know that the cows are the ones that spread the disease.
Okay.
The bulls are the ones that have the infection for life. I mean, once a bull's infected, always infected. But they got infected from the cow. And so we understand that now that the cows are the ones that are kind of propagating this disease within our herds. And so that's where a lot of the thought process are now. Unfortunately, our diagnostics aren't very good in cows. The nice thing about it is cows can clean themselves up if they are sexually arrested for a period of time. So within about 120 days or so, they can get themselves cleaned up.
And so they just form an immune response.
They form an immune response, yes. Now the thing is, once they clean themselves up, they can be reinfected. So if you haven't cleaned your herd up, they can be reinfected.
Oh, okay, gotcha.
Definitely.
Well, let's take a break.
Definitely.
Let's come back. Let's talk some more about some of the diagnostics and prevention for trick in people's herds.
Sure.
You're watching Doc Talk. Thanks for joining us. We're going to take a break, and we'll be right back.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica Inc.
Hello, I'm Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation. Today, on our quick tip of the day, we want to talk about withdrawal times. I've got a question for you. I'm curious if you're following your withdrawal times, or if you've ever had FDA come visit you because you've had a residue pop up or they're looking for a residue. What happens when FDA shows up is they've had a residue pop up at the packing plant. And from there, they just work their way down the line trying to find out where that drug was given and who didn't obey the law and obey the withdrawal. So it's vitally important as a producer that you keep very accurate records, handwritten records, or computerized records, so that every drug you give, you have the withdrawal established. Please don't send animals to the next producer or sale barn without making sure that they are off withdrawal.
It takes vision, dedication, hard work. It takes knowing who you can trust. At Zinpro Corporation, we have more industry-endorsed research behind our trace minerals than any other company. Proof that our patented performance minerals help improve overall animal health and performance. Lots of companies make claims. At Zinpro, we generate results.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
In the springtime, cattlemen need to be thinking of preventing important diseases like pink eye. Pink eye prevention includes management factors like good fly control, pasture management, along with a good vaccination program. Eyesight from AgriLabs has broad efficacy coverage as its origin from 8 different field isolates of Moraxella bovis. It is safe, smooth, highly syringeable, safe with young calves and pregnant cows, and provides superior protection against pink eye.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
TrueTest Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Justin Smith. He is the Deputy Animal Health Commissioner for the state of Kansas, which is a big, big job. And we're talking about something that I think is probably as important as a topic for cow-calf people these days as anything.
Anything, exactly.
I mean, trick and BVD are kind of
the
right
in line
that
with
we
each
got
other.
to control. And when we left, we were talking about how cows carry it. Cows can have an immune response and actually, clean themselves up from a trick infection, but they can be reinfected. So obviously, the bulls is a focus.
The bull is the focus, exactly, as far as the testing and then cleaning the herd up completely. So we go in there and we recommend that they do a test. There again, unfortunately, it's not an easy test. It's a test that requires them take a scraping, a preputial scraping, and then send it in for a culture or a PCR test. And when I say that, Kansas, we recognize the PCR test as the valid test in the state of Kansas. But it is a culture test, so it isn't something you can just go out and draw a blood sample or a tissue sample in that respect.
Okay, so got to work with your veterinarian.
Definitely.
And get them out there. Now, when you were talking, before the break, you were talking about, hey, let's get these bulls tested annually. So when is it? Prior to turnout? Do it when we do breeding soundness exams. Match it up.
Sure. The breeding soundness exam is an excellent place to do it. It really is. Now, if the thing is that you come in and you've got suspicion of it with your preg checks rate, a good time to do it is in the fall. There's no use keeping that bull around because, like I said, once he's infected, he's always infected. There's not a treatment for these bulls, and so.
So if we don't have a problem, do it when we do breeding soundness exams. If we go in and we have a decrease in conception rates, then we might want to go back and take a look at that. And I've gotten some calls from people saying, hey, because the normal, from the time we preg check to time we calve, usually 2 to 3% of those animals will abort. That's a normal,
sure.
Just don't know why, type of thing, but that's kind of normal. But when we start creeping above that 3%, we get up 5, 7, 10%, then we need to start thinking about something infectious.
Infectious, exactly. And that's what kind of trapped some of these producers the last few years, is the fact that they looked at the drought. Well, things were dry, so I felt like I could adjust for a little higher pregnancy rate, when in actuality, it was trick kind of creeping up on them.
Gotcha. So, we've got about a minute to break. On bulls, is there, I've heard there's a difference in yearlings versus 3 and 4 year olds. If you're buying new bulls or buying bulls from different origins, more likely to be in an older bull than a younger bull, but still need to test the younger bulls?
Yes, most definitely. I mean, the only bull out there is if you are assured that he is a virgin bull. But how many people can tell you that they're 100% sure that it's a virgin bull? So, right. No, our recommendation is keep your bull battery young, but and test them bulls no matter what the case may be, unless you just know that you raised him yourself.
Cool. Well, we're going to take a break. And folks, with the price of cattle these days, I think we can afford to get a trick test. For you and your family's insurance and your cow operations, I think it's something that's vitally important you work with your veterinarian. We're going to take a break, and we'll be right back after this.
You know just how costly BRD can be, but did you know that bacteria like Mannheimia and Pasteurella can cause BRD? That's why veterinarians and cattle raisers focus on preventing pasteurellosis with a quality vaccine like Pulmogard PHM1. It's ready to use, highly syringeable, and provides comprehensive protection with a single dose. For pasteurellosis protection that's truly the head of the class, ask your veterinarian about Pulmogard PHM1.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd. This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson, Dr. Justin Smith. We're both here in the state of Kansas. I'm at Kansas State University, and he is the Deputy Animal Health Commissioner who spends a lot of time helping keep our cow herds, swine herds, all of our animal populations healthy and keep us open for commerce here in the state of Kansas, and we really appreciate all that you do.
Thank you, Dan.
And appreciate you being on the show today, and we're talking about trick. And we talked about preventing it in our herds, how, if we have a few open cows, getting the bulls tested, making sure we test the bulls at least once a year, and if you're calving twice a year, twice. But let's talk about if I'm going to sell a bull. Mm-hmm. What are some of the things I need to do if I'm going to sell a bull to somebody or have a bull sale?
Sure. If you're going to have a bull sale, and I'm going to go by, what Kansas's requirement is anything that's under 18 months of age that you can verify has not had any sexual contact is free to sell in the state of Kansas.
And you don't need to test?
No need to test.
Okay.
Anything that's over 18 months of age does require a negative test prior to change of ownership. Now, that isn't the case in all states. So if you're selling bulls out of state, I strongly recommend that you call that state animal health organization and find out their requirements. That is one of our issues across nationally is the discrepancy amongst different requirements amongst different states. And there's an honest effort to try to rectify that.
Yeah, it'd be nice if we could all be on the same page. You'd think that would be something that wouldn't
Definitely.
take too long.
Exactly.
But with that in mind, how long does it take from the time you do a preputial scraping until I get my results usually?
Okay. The goal is that we want it in the lab with no later than 72 hours. It's got to be to the lab within 72 hours. They will incubate it for 24 hours, and then usually within that next 24 hours, they've got you a test result. So the quicker you can get it to the lab, the faster it'll be. But once it's in the lab, anywhere from 24 to 36 hours.
And you guys have been on the road working with veterinarians, working on CE, doing labs on how to take the samples. Most every veterinarian's ready to go.
Ready to go, exactly. That is something that we have implemented, is the fact that we want our veterinarians trained up and to understand that the shipping and the handling and the collection is important as the test itself.
Is there anything to, also kind of like the validation that this was taken by a veterinarian? Is there something on a federal regulation that a veterinarian needs to do the testing?
Not federally. Kansas has implemented, though, something that our veterinarians are accredited or certified to be trick testers for change of ownership testing. But no, this is not a federally regulated disease.
And that way it just helps protect people against fraud. It gives us a third-party opportunity to do this testing and move things forward.
Definitely. This is a validation. Exactly.
Cool. Well, thanks for stopping by and thanks for providing us this information.
No problem at all. We're glad to do it. Thank you for having us.
Folks, Dr. Justin Smith here in the state of Kansas, our Deputy Animal Health Commissioner. Thanks for watching Doc Talk today, and remember, always work with your local practitioner. If you want to know more about what we do here at Kansas State's College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. Thanks for watching Doc Talk. I'm Dr. Dan Thompson here from Kansas State University's College of Veterinary Medicine, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Boehringer Ingelheim Vetmedica Inc., the makers of Triangle Vaccines. Triangle, protection you can trust.
It must be an inherited trait because I have never wanted to do anything other than be in the cattle business. And it's interesting as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.